I hope that everybody's here. We planned this kind of webinar live on Facebook maybe a week ago with Mr. Kurosh from Parse Dental Lab, and the goal of this particular webinar is to discuss how to go about creating a surgical guide for some of your patients who you want to go ahead and do surgery. Now, Parse Dental Lab is extremely gracious to allow me to go ahead and tap into their Facebook page so we can have this live on their site. They are a strong sponsor of my course, DISS, Dental Implant Surgical Seminar. And one of the things that I was discussing with Mr. Kurosh from Parse Dental is people are interested to go ahead and do a little bit more guided, and how can we help them out by designing, by treatment planning their guided cases for them. Now, there are DISS faculties who are basically active on this case, that they can go ahead and look at your plans and whatnot, and we're going to discuss what we can do. You can go to our website, and I'm going to show you where to go, download a prescription, and you can basically send the prescription in to us through email, and we can discuss each case on an individual basis, and I'll tell you what the requirements are in order for us to be able to work on those cases for you. Now, I have a couple of cases here that I wanted to go ahead and show you. There is a patient with a jaw model and how to get started. Now, the best way to go ahead and get started is to have the correct armamentarium. Now, it doesn't matter what type of system you use today. You could be using Straumann, you could be using Nobel, you could be using Buskai Bio, you could be using any system that you wish to go ahead and use. But I'm going to show you what I have and what I do. Now, we do surgeries for many offices as far as just providing their surgical needs. And every office obviously uses a different implant system for whatever reason, and that's okay. But now, how about if I want to do a fully guided type of case and not have to worry about having multiple kits in my practice in order for me to go ahead and do that? And that's how we're going to come in, and a couple of recommendations that I'm going to have to make for you in order for you to get set up for your guided cases. Now, I'd like to, Pierre, you could come over here. I'd like to go ahead and show you a guided kit from Buskai Bio. This is a fully keyless guided kit. Okay, let's open it up and we're going to take a look. Now, a fully keyless means that I'm just going to pick one of these burrs out so you can take a look and see what I'm talking about. Let me pick up an instrument so this way you don't have to look at my non-manicure nails. All right, so here is the fully keyless kit. What does that mean, a fully keyless? Okay, a fully keyless means that this burr has a stopper at this point in this area. Okay. Now, this is the area where the computer generates your coronal apical position of an implant on every single case, on every single implant size, if you will. Whether you're putting an 8mm implant, whether you're putting a 13mm implant, that calculation is coronal apically is made through the computer onto your guide. I'm going to show you a guide that we did yesterday. Okay, so here is a guide, right? This patient got 4 implants, and we're going to discuss this particular case together. This patient got 4 implants yesterday, okay? Now, what I mean acronoapically means that whether this implant is a 10 millimeter, whether this implant is a 13 millimeter, when I insert this in and it goes all the way to the top, this calculation of an apical coronal portion is made totally with the computer generated on the guide, that you could go ahead and put the burr in and it gives you a stopper. That's what it means when it says a keyless. There's no key in here, and every single burr has a stopper to it, so it stops, okay? Now, it doesn't matter what system you're using, but my recommendation for you is this is a small investment that you could go ahead and make for your practice, to have a kit like this that you could go ahead and start. Now, the implant sizes for a Blue Sky Biomax, I'm sorry, I'm just gonna put the light on the camera for a second. Let me just see if there is. No, okay, we should have put the light on. Okay, so let's just continue. I apologize. I would have wanted to go ahead and put a little bit more light so you can go ahead and have a better look at this. But the sizes for this particular case, this is a Biomax keyless kit that has a 6 millimeter, 8 millimeter, 10 millimeter, 11.5, and a 13. Now, these numbers are very much basically a standard numbers. Most implant systems have 10. Most implant systems have 8. So you don't even have to worry about, most implant systems have 13. Most implant system may have 6 and 11.5. So I, generally speaking, for example, this is a kit that I used to do the surgery yesterday, but this particular case, a patient got an MIS implant, okay? And an MIS implant actually has the same length in implants as well as the width. So it really matches very well for those of you out there who do MIS surgeries. Then this would really work very, very well for you. So you don't have to deviate from anything, except at the very end, you take the MIS carrying tool and you basically put the implant through the carrying tool. So that's basically what it is. And I would definitely suggest you can go ahead and call Mr. John Carey, who's the general manager, and they sponsor our course as well. And you could call him at Blue Sky Bio, and they can go ahead and basically send you this kit. Now, let's go through the kit. Just very quickly, we have a 2 millimeter burr, 2.5 millimeter, 3 millimeter, 3.9 millimeter, and a 4.5 millimeter burr in length. I apologize, it's a 4.6, okay? Then what you have on a guided kit, you have a carrying tool for the implant system that you could go ahead and connect. And I have actually some dummy implants, excuse me. Let me just take a dummy implant so you could basically take a look and see what it looks like. These are the dummy implants that people use in my course to actually place an implant. That's what we're gonna go ahead and do. Then you have a carrying tool that you can go ahead and hand tighten basically into the, and we're gonna demonstrate that today. You could hand tighten this into the jawbone, and after you hand tighten it, then you have a torque driver that basically connects to the top of this, and you could go ahead and torque it down. Now, this system allows you to insert your implant with this carrying tool, okay? So that's a beauty of it, that you can actually be fully guided. That means fully placing even the implant through the guide without removing it, okay? So that's the beauty of it. With the MIS, for example, yesterday, and I'm gonna show you some photos of the surgery that we did on my computer, we're gonna go ahead and do this and place this implant. And I'll show you on that case of how it is, but I had to remove the guide in order to place an implant and use the MIS carrying tool. Now, with this particular guide on this kit, you do not get a carrying tool for your handpiece. Okay, this is a carrying tool for the implant, but this is a latch type that goes into your handpiece. So this I purchased directly, and I put myself in here because I modify, and I don't know about you, but any implant system that I have worked with, I have modified and I have add more stuff into the surgical kit that I need. For example, this kit does not come with a extender. Don't ask me why, it doesn't. I buy an extender and I put it in here. Now you have 3 paralleling pins for a startup of a 2mm on one side and a 2.5 on the other side, so you could switch it around. Now these connections, I have my assistant Pierre, who's videoing right now for us, to put these floss, or you could go ahead, these are a silk suture that I buy as a loose silk suture, and I use that, and you could autoclave it, and every once in a while you have to switch it. Now the reason I put this in, can you guess why this is? And look how long I put it, okay? The reason I do this is these little things can drop in the patient's mouth very easily. Especially if the patient is sedated, you could grab this thing and take it out. That's why we have these connections on them. Okay, now I want to show you something interesting that I always do, and take a look at what's underneath this kit. These are all the other stuff that does not include, and I make it specially for the kit that I use. Okay, I have this fixation pins that I bought separately, and I put it in here with a specific burr, and I'm going to show you what we do with that. Okay, that I can go ahead and make the osteotomy for the fixation pins. Then I have this connection that actually comes with it with a hex driver. Okay, I have another carrying tool that's not for guided, it's a non-guided. I keep it in here. I have a bunch of other burrs, different size burrs from other kits that I put there. But the most importantly, I love my other paralleling pins that I can go through the entire surgery with using a paralleling pins. I don't care how many osteotomies you make, you can deviate from your original site if you do not check yourself on every osteotomy. Okay, and we have a bunch of other, paralleling pins, and a driver, a special driver from Nobel. I actually like this one better. It fits much better to the Blue Sky Bio healing abutments and so on and so forth. It grabs so much better onto their stuff. So I have that in here, and I use this. And a round burr, this is just to go ahead and clean up the socket after you do an extractions and things like that, which does not come in this kit. So I definitely recommend that for you. So you have these guys in here. We're gonna close this, but I wanna keep the, we're gonna keep that fixation pin out so we can go ahead and go through with this. So now, I just want to show you, if Pierre, would you mind coming over here into the computer? So here is our website, okay? The website is Dental Implant Surgical Seminar. You will soon find a button on the Dental Implant Surgical Seminar where it says download a prescription. Okay, do not do that because it's gonna go in it. It's gonna tell you download a prescription for your surgical guide, okay? You can certainly come to the site, download the prescription, and I have a copy of the prescription right here. That it's actually asking you a few questions about the patient. I ask what you are doing on this particular patient. You could send a treatment plan very vaguely. You could go ahead and tell us which site you're putting an implant in, what kind of restoration you want to go ahead and do, and what kind of guide you're looking for. It's a basic guide, which is a 2mm guide, or whether you want to have a fully keyless. And I definitely strongly suggest, and I don't, as I said, I don't care what implant system you use, but it's definitely, it behooves you to go ahead and get yourself this Blue Sky Bio kit, so at least you could go through the entire surgery guided, except when you're ready to go ahead and put an implant in there, okay? Then on the very, very bottom over here, I ask, is it a DICOM? You can certainly go ahead, and it's a free app. I apologize, not an app, but a program from Blue Sky Bio. Sign up with them, and you could go ahead and get a code, and you put it in there and actually be able to use their system. So we're going to need some STL files, DICOM, and all those things can be done really with Parse Dental Lab with Mr. Kurosh. If you live in Houston and you want to go ahead and use our services, and this is really gearing towards you guys because we are basically doing this on a Parse Dental Lab site. You can call Mr. Kurosh, and he can walk you through all the information that I need and the DISS team needs in order for us to be able to go ahead and provide this service to you. And you can go ahead and basically send the patient to them. They can do the CT scan, and I believe there is a cost for that of, you could ask him, I don't want to say. And also you can send us a STL file, and I think as a courtesy they will actually go ahead and keep the STL file, and they will do that for you, and you can basically try to get all that information, and he can go ahead and send me that particular information so we can move forward. And I need your prescription so we can go ahead and give you a call, find out what exactly you are planning to do, and we go from there. Now, let me demonstrate. Now that we discussed that, let's go ahead and show a case that we are going to go ahead and do, and we'll do one surgery. So here is a patient. Okay, I basically have taken the patient's jaw model, okay, and we have printed out the patient's jaw model here. I have made a guide for the patient. Just I apologize for this side. This side is a fracture side, but we're gonna go ahead and just do this side for now, okay? And you can see, and you can do this yourself, and you could have us actually send this information to you if you choose, where we can send you the model of the patient with the guide, and you can go ahead and do the surgery yourself first on the model. Get a perfect look of what exactly it's going to look like once you finish with and then compare that with your surgery on a live patient after you're done. So this is a good practice for those of you who are starting to go ahead and use guided, just to get kind of going to recognize exactly how this is going to actually work, and whether you were able to translate what you were able to do on the model into the patient's mouth. Okay, now I have these dummy implants that are 4.3 by 13, so we are kind of bound to do the surgery on a 4.3 by 13, but it gives me a good indication of, let's take a look and see. You see a little indentation here. Can you tell? There's a little indentation here. Okay, I'm gonna actually get my lube for a second, if you will. Just have a moment so we can go ahead and do this. Please, if you have any questions at this time, if you have any concerns, if you want to go ahead and ask, go ahead and ask your questions, and I'll try to go ahead and answer as well as I possibly can. And let me see if this is gonna actually be too bright. Is this good up here? Does it look good? Or is it too bright? Okay, very good. So we have the guide, and now maybe you are able to see the indentation. Now, I would never go ahead and put, let's take a look at here. Look how thin this bone is on a coronal portion. Look how much a patient is missing here. So we definitely would never go ahead and place an implant of 4.3 by 13 in this particular case. And look, you have your nerve over here, and we can indicate that. You could see where the nerve is. So you have all the information that you actually need on your live patient. And here is another the mental foramen coming out through here. So, and one of the indication of a mental foramen is that the nerve on mental foramen is never above the mental foramen. Okay, it's either, generally speaking, aligned with mental or below the mental. So therefore, when you are looking at this, okay, you have an ability to go as close to the mental as you possibly can, and I definitely recommend you stay 2 to 3 millimeter away from the nerve, okay, to be on the safe side. So this particular case, if the mental is here, I know that the inferior alveolar nerve will not run above here, so I would just put the implant over here, and 10 millimeter would be suffice in this particular case, and you'll be in good shape. Okay, so that's why having a model of the patient's jaw is definitely very helpful onto you practicing on. Once you become a little bit more seasoned, then you could go ahead and do however you want to do this. You don't per se need this. So here's the guide, and the guy sits in here, and you could take a look inside. Take a look inside here, okay? You can see how much I'm missing here, right? I'm gonna put my perio probe and look. So we'll definitely not put a 4.3 by 10 in this particular case. Either we'll do a graft or possibly a 3.5 or something like that. But for the purpose of just education, we're gonna go ahead and do that. Another thing I wanna tell you about the guide is this. Take a look at these space. These are generated basically through the computer. And this we have a tooth in this area, we have a tooth in this area. And when you generate that, these spaces are left. So we can go ahead and basically seat the guide. And one of the things that you need to check on your patient is to make sure there is no space between the tooth and your guide. You see this space? There is no space here. Let's look at it on this one. There's no space on that premolar, there's no space over here. If you get a guide that's basically, let's say it's sitting like that, okay, that means there is something holding it up, whether it's inside the guide that's holding it up, or it's something from the patient's tooth with the undercut that's holding it up. So here, let me show you on this side. You see, this side is also, look at, this is a canine, and take a look. There is really no space. Now, generally speaking, I also open up another one here because the distance from one side to another side is very great. I open up another area here to check to make sure that the anterior area is also seating well and properly. So you have multiple locations to make sure that your guide is actually accurate and it's seating well. Okay? Anybody has questions? No questions? Let's move forward. Okay. Now, the first thing you do on a guide is to make sure that we take a benefit of the guide fully, 100% all the time. This implant is going to be a 4.3 by 13, right? So let me take a pilot burr of a 4.3, stay here please, 4.3 by 13, okay, and I put it in here. So I'm going to put the 4.3 by 13 in here. Take a look. Will I get the benefit of the guide at this point? Because I have to, in order for me to go ahead and get a full benefit, look how much I have to go, because this is the area that actually engages. This is the area that engages into the tube, to the master tube. Okay? So now, look how much distance you have to go to figure out your trajectory of your implant before you could get a benefit of the guide. It's tremendous. You may not know that. You may not be able to go ahead and know that. If anybody asks a question, just let me know here. So here is, that's why number 2 millimeter, the pilot of number 13 millimeter guide is not going to be a good idea. So what do? Let's take a 6 millimeter guide. Okay, and we go with the 6. Now take a look. Even with the 6, here, the 6, I'm able to go ahead and engage into that tube. okay, that means immediately I am benefiting from my guide by simply putting a 6 millimeter, okay? So your first startup burr is going to be a 6 millimeter. So let's do this now with a 6 millimeter. I put it in. You saw that? Immediately goes in. Now take a look. I hit this. Now remember I told you I put an extension tube into my kit. It does not come with this kit. Why? Because the company does not believe that you will need an extension tube. But I believe you need an extension tube. So here is an extension tube. I put it back up. Now I can seat it all the way. You see it's seating all the way? Out. Take a look. You see that? Now, generally speaking, what I like to do at this point is I take one of my paralleling pins and I put in here and I take a x-ray with it in the patient's mouth. Okay? If it's too cumbersome, then you don't have to worry about it. You could just remove it and just put it in there, and probably have to do this side. Okay? Take a look. Okay, it's pretty good. Okay, we are where we want it to be, right? So then, after we're done with that burr, now we're gonna put the 2 millimeter pilot by 13. Now look what is gonna happen here. The minute I put this in, now it actually goes in further. Let me just take this extension. Now once that happens, now I'm in more and I can engage with the 13 millimeter. Okay? Once you have that and you go, obviously I want you to take an x-ray to make sure everything is good and dandy with the patient and you're in the right spot. Always check yourself. Never rely 100% on a guide, okay? But here is the next burr. Take a look. The next burr I'm gonna come in, same thing, does not engage. You see that? Does not engage. So now, we gotta go back to the next burr, is 6 millimeter. You open it up a little bit, put the 13 all the way down, and the reason you're not getting so much is because these are not as solid of the model as the patient's own bone, so therefore we're having just a quick check on the patient. Put the paralleling pin in there. Oh, perfect. Exactly the way I want it to go ahead and be. Let's take a look at the model. Okay, look at your osteotomy. It's perfect in the right spot, exactly where you want it to be. Okay. Next burr, I'm actually going to skip one burr over here. I'm going to go into the last burr before the implant goes in. Okay, now let's try this out. I'm probably going to be able to engage it anyway. Now look at the stopper. Okay, you have nowhere to go but to go ahead and go exactly where the guide lets you. Okay, take it out. Okay, now once you have this and we are finished with our pilot osteotomy, now you want to, if you're doing a Biomax implant from Blue Sky Bio, then you could use their entire system to place it fully guided. If you are not, at this point, you're going to remove your guide, and you're going to go ahead and put your implant in without a guide, with a recommended company carrying tool and an implant. That's what you're going to do. But let's say if you have a Blue Sky Bio Biomax implant into your in your office and you purchase that, you could go ahead and you put that through the guide, take a look, and you tighten it up a little bit. Now, watch this. If I'm using the very tall carrying tool, I would not be able to get a benefit of the guide. So you can take this off, take the shorter carrying tool, thank you, and so even so far, I'm not getting a benefit of guide because this implant is way too long, and but now at this point, you see it's engaging now. Here is this point at this implant have nowhere to go but exactly where you want it to go. Okay, there are markers on this that allows you to go to 8mm implant, 10mm implant, 11mm implant, and a 13 or 11.5, I apologize. Okay, so I put that one in, and now I hit the tooth, I switch it to the longer one, now this implant company, there's notches in here. I don't know if you can see it actually. This implant company recommends that you place their implant a millimeter below the osseous. So I'm seated all the way. I remove and take a look. We are exactly where we want it to be. Okay, we're exactly where the implant is supposed to be, in a perfect location. Again, I would never place this size implant in a patient like this. This is just for demonstration purposes of the 4.3. This implant probably would have been for me a 3.5 plus some bone grafting regardless, okay? Because I don't like this indentation here next to the implant where it's gonna go ahead and collect food. So routinely today, I graft this site, not necessarily so much because of the implant, but because I wanted to create a hygienic environment so the implant will not have a big problem. Okay, so here is a demonstration of doing this case. Now let me show you a case that we did yesterday, and here is the guide for this particular case. Now one of the things that we do is that we create this fixation pin. Now the company gives us a fixation paralleling pins, which basically it fits inside. And I was planning, we're printing out the patient's jaw, but we ran out of time and it's not ready yet. But I was gonna demonstrate that on the patient's model for you today. This surgery was done yesterday, and I did it in a friend of mine's office where he likes to place MIS implants. So I basically made a surgical guide from Blue Sky Bio. I follow our Blue Sky Bio protocol. The size of the implant is pretty much the same, okay? But the fixation pins are what actually holds things in place. This is a patient's denture. That basically what we did was we take the patient's CT scan where we're doing a dual scan of the patient. Patient has a marker on the denture. We take a CBCT of the patient with the denture in the mouth, and then after patient comes down, and then we'll take the CBCT of the patient's denture alone on its own, and then we can go ahead and merge these two entities together. So let me show you now on the computer what exactly I mean, and then I'll show you some photographs of the surgery. It's not organized really yet, but I will show you that. Meanwhile, I just wanted to go ahead and mention, if you want to see some of these surgeries that I do and you want to go ahead and pick up some pointers, you could subscribe to our YouTube channel, Dental Implant Surgical Seminar. and I have a variety of videos there and things like that you can go ahead and watch, and even ask your questions. So let's take a look at this, first the plan on this particular case. Let's talk about this plan a little bit, and then once we talk about the plan, I'll show you some photographs from yesterday's surgery. So Pierre, if you can, just let's come over here into the... So here is the patient, okay? And this was a discussion that I had with my, you may have to come a little bit closer. So here is the discussion I had with my referring doctor. Take a look at this axial image, and this is really throughout the entire case, this is what we are looking at. Look how thin the patient is. Look how thin. The patient has a tooth here, there's a tooth here, there's a tooth here, and then there's a couple of teeth in the anteriors, 8 and 9 and 10. But you see how you have bone here? These bone in this area is simply due to having the teeth in this area. You have a little bit of a bone here, but that's only because this tooth is there. These two, number 2 and 15, it's only because these guys are there. So he wanted to take out the entire teeth, insert a denture in its place, okay? And I suggested that if we don't do this in an immediate setting, and we can go ahead, and if we don't break it up in an immediate setting, we may have a big trouble actually putting any implant in the future on this particular patient, simply because look how much bone loss the patient has had. So everything is going to melt away. So let me show you a 3D image so you can appreciate what I'm talking about. Look how thin this bone is. Look how thin this bone is. Okay, now take a look and see how much bone we got here, how much bone we have here. Now this particular patient is going to have, and we have a couple of teeth over here, as you can see, this patient is going to have a overdenture. Okay, we're going to place 4 implants for an overdenture. The minute you take these teeth out and you don't do anything as far as implant, even if you bone graft it, I'm not so certain that waiting 4-6 months, how much bone is going to be actually restored and stay and not melt away. And what if a patient doesn't show up for another 1.5 years? Then that window of opportunity is actually closed. So what I did was I treatment planned the patient for 4 implants. Okay, 2, 8, 9, 15. And these are my fixation pins that you just saw on the guide. Okay, so that is my plan. Now, generally speaking, most people do not spread the implants this far apart. And I don't either, but you know what? You really don't have much of a choice in this particular case. You're really stuck. You're not able to do anything more than this. But this will give the patient a really, really nice, beautiful, stable implant. Not only that, now try to go ahead and parallel number 2 to number 15 without any guide. I've been doing this for a while, and this is difficult. To try to go ahead and extract 2 teeth and try to parallel these 2 implants together. Not very easy. You're placing each of these implants in an immediate site. Let me explain something to you. And an immediate denture is not an easier surgery as opposed to doing an implant straightforward into the bone. Most people think immediate denture, I'm going to take out a tooth, stick an implant in where the tooth was. Most of the time, the apical portion of the implant is not or should not be at the apex of the existing tooth. You have to move it. Implant needs to be on a lingual section of your osteotomy and not dead center where the apex of the tooth was. So naturally what happens, the implant, when you're placing it on the lingual position, it generally speaking wants to go ahead and move into the path of least resistance, which is to the buccal. So you place an implant in there, you're taking photographs, and what happens? At the end, the photograph shows up and you say, oh my gosh, what the heck happened here? The implant now, all along it was in the lingual, I placed an implant, it's sitting at the incisal edge of the tooth. That's only because even placing an implant, it becomes very, very difficult. So, this particular case, I want to show you the cross-sectional on each one of them. Here is 2. Okay, this number 2 is 5 by 11.5. Number 8 is 375 by 13, and we're actually engaging the cortical level of a nasal, just the inferior nasal cavity. Okay, so yeah, you have a nice connection to that. Okay, you could only do that with guide. Number 9, same story. Okay, 375 by 13 millimeter long, and number 15 is 5 by 10. Okay, and I'm engaging the floor of the sinus, slightly peeked into the sinus maybe in some of the areas, but I really don't care. I actually wanted to go ahead and grab on that cortical level over here so I have a good stability of my, because again, in the tuberosity area, in the close to tuberosity posterior maxilla, you have a very soft bone, so therefore it's probably best to go ahead and try to grab on something so you have a good stability of the implant on an immediate case. Okay, so here are your implants. I'm just going to lock them in so that nothing will go ahead and move. Now let's take a look at, so here is the patient's denture that was scanned and transferred to merge into the patient's CBCT. Okay, so this is the patient's denture. There's a little bit of a cutoff over here. I really don't care. It doesn't matter to me. I just want to see where it's coming out from. Okay, and one of the things that I have a very big problem with a lot of machines today, with the CBCT machines, they have these platforms that you could go ahead and put the denture on, but look what happens. Look what it gives you. It's a solid platform that shows up on my 3D. And in order for me to get rid of it, I have to cut some of the tooth structure on the denture, which I don't understand why they make it that way. Why they make a solid entity that will show up on my CBCT. That's just beyond me. Okay, and all of them, or most of them, have this problem which nobody is addressing. Okay, I want something that I can only see my denture and nothing else, so I can take a look at the occlusal level here. This area, I cut it away. That's why part of the tooth is missing. Okay, but I want to take a look at a cross-sectional and axial view on my 3D, see exactly where it's coming from. And now I have this entity that's sitting here and does not allow me to see exactly where these implants are merging into the denture. So anyway, that's another beef I have with a CBCT companies that make these CBCT machines. Anyway, let's move forward. So after that, I apologize, let's put this one. After that, I will go ahead and make the guide. Here's the guide, okay? This is exactly a copy of what you just saw and I showed you that we did the surgery on, okay? But I want to tell you what the Blue Sky Bio actually recommends. They do have a cylinder that sits on your fixation pin. These are the fixation pin. Now, if you're doing a tissue-borne guide, you have no choice but try to hold on to this tissue-borne guide somehow so it won't move while you're doing the surgery. So I find multiple locations that does not disturb a tooth, that does not disturb an implant, that does not disturb any structure that I need to go ahead and actually do, okay? And I put these guys in there. One of the things that I do that the program does not do that, and I custom make them, are these supporting connection. The supporting connection that comes as a default is not this long, and it's not this small. My connection is 2.2 millimeter because I have a burr for a 2.2 that I use from my Straumann kit, and I use that to go ahead and do that. Why? Because their pin is 2.2. The Blue Sky pin, fixation pin, is 2.2 in width. So what I do is I take this and I make this longer, okay? Let me see if I can actually show you what I mean by that. Let's get rid of So let's just do this. Let's stick a pin in there so you can all see what I'm talking about. Here's a pin. I'm gonna stick it in there. It's just arbitrarily. I don't know whether this is a good site or not. When you drop a pin inside, okay, you have to sit there and actually play around with the pin to make sure that it's in the right spot. So let's just, for argument's sake, say that this pin is in the right spot. I'm just gonna pull it out. Let's just move it a little bit. Okay, so now here is our pin. Right now it's in there. I'm gonna lock the pin, okay? I'm gonna put a guide tube on it. So now take a look at the guide tube that shows up as a default from Blue Sky Bio. Take a look at my guide tube. I'm gonna show you the other side. You see how my guide tubes are so much longer? This, number one, gives you a better guide, okay? And number two, if I get rid of the implant in this area, just to show you, 1 second. So it actually does not allow me to go ahead and, maybe that's because it's, okay. Okay, so come over here, Pierre. Would you mind coming down a little bit here? Okay, so here it is. Now take a look at the difference between the two guide tubes. Look at my guide tubes and the diameter of the guide tubes. This is 2.2. This is 3.5 or something like that. And what it does basically is, I'm not gonna go with my mouse because it's gonna do that. What it does is, the Blue Sky Bio, you could buy a metal tube that gets inserted into this, and you could go ahead and do the surgery with. And now you have to have, then there is another moving part that you need to worry about. In this particular case, I don't have a moving part. It's all acrylic. There's nothing moving. It's in there, and you go ahead and put your burr through and you do the surgery. I'm gonna show you a photograph of what we did yesterday. In this particular case, this is in there, it's glued in there, and now you have to worry about another part coming down. Maybe the glue didn't work so well and things like that. So what I like to do in this particular case is, I like to go ahead and reduce this size, make it longer. That's gonna hug my guide, my pin all the way, and make it smaller, so this way the pin will actually go ahead and intimately go in there into the bone. Okay, so that's what we do with the fixation pin on this particular case. So let me just show. So basically the treatment plan is this, and now let me show you a couple of photographs that we have taken to basically try to show you okay, so everything has its own computer and its own So here is the guide that you just looked at, okay? These are fixation pin, obviously. Here's the patient. Patient is wearing an immediate. The referring doctor cut the teeth to the gum line and basically inserted the immediate denture, okay? And we use this immediate denture in order for us to go ahead and make the guide. Now take a look. All these areas where a patient has no ability to go ahead and get an implant, except these are the areas. So my plan is one implant, one implant, one implant, one implant, okay? Here's the guide in the patient's mouth. It sits there nice and intimately, but now I have to go ahead and fix it. So we extract the teeth, and here's our fixation pin with a 2.2 millimeter Straumann burr. I make the osteotomy. There is no reflection. There is no tissue movement. There is no swelling after this. This is the key into the guided surgery. When you keep things simple, a patient is happy and they're thrilled about and they call you and you call them up the next day and you ask them how they're doing and they're doing fine and have zero pain. That's the key. So here is my 2 pins. The last one is going in. Okay, now one of the things I do is when I make my osteotomies, now in an immediate cases, you may not have to go ahead and go with a 6 millimeter like I demonstrated on the model, because you already have a socket that you have to go through. So this particular case, I was able to go with the 13 millimeter implant, the burr, right away, okay, without going to a 6. Because when you put it in, part of it is going to go into the socket before it meets the lingual bone, okay? And one thing I do is, once I make a osteotomy, this was a 13 millimeter long, and I'm making the other osteotomy, and this is 13 millimeter long burr, but I don't have 2, of course. So I put another, the 11.5 in here, and it gives me a little bit more support. Okay, so now this is in there just for me to make sure that the guide in the anterior is also stable and it's nice and strong while I make the second osteotomy. All right, so I leave my burr inside there. And then also you could go ahead and check to see, your parallelism. Here is your parallelism. Take a look. Now, always try to take this out. Check your position. Do I need to take an x-ray here? No. I only take x-rays when I have to go ahead and deal with teeth, see the proximity of the teeth to the implant, see if how close I am to the teeth. But if I don't have any teeth and this is going to be an overdenture, I really don't care. I have the guide, I take it out, I make sure that everything is good. You want to take an x-ray? Go right ahead. I just don't think you're going to see any more with taking an x-ray, especially when you're not close to any structure like a sinus or a nerve or so on and so forth. So take a look at these two. This photo is concentrating on these two, okay? Take a look at the parallelism of these two implants. Look how nice and parallel they are. I wouldn't be able to even do this so easily without putting some effort into it. But once you plan your case on the computer, spend a little bit more time on the computer trying to go ahead and make sure that you're doing things right, then you don't have to think about it during the surgery. Here is the next burr. Here is the next burr. You could see I keep it in there. Here is the implant. This is a 375 by 13. It's a MIS. I left the guide in there. I just go in the middle of it and I just drive it in. I switched my 5mm implant to the 6mm implant by MIS. So the posterior implants they got is 6mm. Okay. Now here are the paralleling pins that you could insert on top of your implant to just check your parallelism with an MIS implant. Okay. You bone graft the sides and you get out and suture it and done. Easy. Just wanted to show you some of the sites where we put those fixation pins, okay, into the patient. I don't even suture this. This will heal very easily without any problem for the patient. There's another one on this side, okay? So there's one on this side, on the right side, and two on the left side. You could put as many as you choose, okay? And here is a final x-ray of the patient. Take a look. I just want to block out the patient's name. I apologize. Take a look at how parallel these implants are. So now the restorative dentist can go ahead and put their locators, and they're going to be straight locators, not angle locators or anything like that. And the beauty of this is that the more angulation you have of your implant in relationship together, the more you're going to have problem with your, if you have experienced this and you have patients in your practice, you will understand what I'm talking about. If you're not as parallel, what happens is those plastic washers in the locator, they wash out very, very quickly, and the patient comes back with having denture that's not very stable. And then you wonder to yourself, why is this happening? And the reason it's happening is because the implants are not very parallel, so those washers wear out much, much faster, much, much quicker. Okay, so once you have it nice and parallel like this, then you won't have that issue and that problem as far as, you know, wearing out those washers, because the strain on those washers are going to be limited to just a general function of the patient in their with their denture. Okay, and again, it depends on the patient, the age, and what they like to go ahead and eat, of course. But if we can eliminate some of that with our with our work, that would be wonderful. I just want to point out in here, Pierre, can you come a little bit closer in this area? So take a look and see, look at how you see that the floor of the sinus, that's cortical area of the sinus, we're engaging at the apical location to this. Same thing over here. Now, of course, part of it may be into the sinus, but it doesn't matter, and it's okay. And I don't think it's an issue or a problem for a patient, okay? But that gives me a great stability, okay? And also the floor of the nasal cavity, okay? But you could only do that when you're accurate with the guide and you're able to go ahead and go into the exact location. If you want to go haphazardly on yourself, with yourself, then you need to pay a little bit more attention and be a little bit more careful. But if you have something like this, well thought and well planned and so on and so forth, then you will have a successful result on this case. So just to kind of go over, let me just see if we have anyone has any question? So the way it's going to go ahead and work is we are going to have a prescription section here. We have a prescription section right here. You could go ahead and go into this area and you could download your prescription for a case. Discuss that with Mr. Kurosh and take a look, and you could certainly go ahead and give us a call and talk to us individually on individual cases, and we can discuss each case by its own merit. I definitely recommend going ahead and downloading a Blue Sky Bio planner onto your computer. It's a free planning software that you could go ahead and have. And if you need anything as far as the surgical kit that I discussed, you can go onto blueskybio.com, or you could go ahead and call Mr. John Carey and let him know that you listened to a webinar by me on Facebook, and here he is. He was on our Guatemala course, so you can go ahead and call him up and get that kit. So I definitely think it makes your life a lot easier. We have a couple of courses that we run and we teach this kind of stuff. One is in Guatemala, and the next meeting is going to be February 24th to 26th. The sinus course is going to be 26 to 28. Then we have a New York course, which you will do a hands-on surgery on a live patient. On September 15th is the lecture. October 27th is a live surgery. In this particular course, you have to have a New York license in order for you to be able to go ahead and do this work. But in Guatemala, we will provide you with a temporary license so you could practice over there. Our Guatemala course is a one of the better courses that you could find, where it shows you surgical guide. It's a state of the art. The university is really beautiful. The location is beautiful. Mr. Kurosh was there and helped us with our last course, and it was really a wonderful thing. And you come home with 24 CE credits. You place close to 20 implants, and the number of implants really depends on you. You could put 50 implants if you have the time, or you could place 10 implants depending on what you like to do. But so far, the purpose of what we talked about today was, if you're doing implants and you want to go into the guided, then you could go ahead and get in touch with us and download our prescription and come in, and we can go ahead and discuss each case on its own merit and discuss, and we treatment plan it for you. We make a guide. The New Parts Dental Lab will make those guides for you, and you can pick it up from them, and you can have those surgeries. And I would definitely tell you that if you do not have a CBCT, you could send it to them directly, and they will also do your STL files. So on that note, let me see if I one other thing. If you are interested, you can certainly go ahead and go on our you could go and subscribe to our YouTube channel. It's a dental implant surgical seminar. I have some of my surgeries already there. This particular lecture will be posted there after we're done, and you can go ahead and ask your questions over there, or join us on our Facebook page on Dental Implant Surgical Seminar, and we can go ahead and basically communicate with each other as far as let me just so here's our Facebook page, and you could go ahead and like us and just get information as we go regarding our courses and what we offered to the public. So I thank you very much joining us today on this I hope this was helpful for you, and please get in touch with New Parts Dental Lab and Mr. Kurosh regarding your guides, and if you need our help, just fill out the prescription form and email it to us. All the information is on the prescription form, and we'll get on the phone and we'll discuss each case by case as it comes in. Okay, I really appreciate it, and hopefully we'll see you on our next one. All right, have a good day. Okay, hello everyone.